Hey Mr. Smiley, so this is my first video. This one is the ankle injury video. So just listen and find out how to fix an ankle injury. So the first thing that you're gonna do is make sure that you follow the RICE acronym. RICE means rest, ice, compression, and elevation. So pretty much if someone comes to you with an ankle injury, just tell them to do those 4 things. So the first one is rest. So I don't know if you can see this, but my victim of an ankle injury is currently laying on a couch with their foot underneath a pillow, just for comfort and for safety, kind of like that. Next in the RICE acronym is ice. So right here I have an ice, an ice pouch with paper towel wrapped around it, and on the outside there is an ankle sprain. So I'll hold that ice there for 15 to 20 minutes and check every 2 to 3 minutes to see if it's red, and if it is, then keep it off for a little bit because that means it's too cold or irritated. Next in the RICE acronym is compression. So if you have an ACE bandage, use that. Pretty much all you do is wrap the victim's ankle until it is completely supported, completely compressed, and it will make it feel a lot better and a lot more comfortable for the victim. That's very important, just so that it's not like kind of just flying loose or uncomfortable for them. After I wrap this, the next step is elevation. So in a second I'm gonna grab another pillow to make it elevated above the heart so that there's less blood flow and swelling is kind of reduced, so that's good. And that's all of RICE. So that's all you do when someone gets an ankle injury like a sprain. Hope you enjoyed that. Hey Mr. Smiley, this is my controlling bleeding assignment. Pretty much in this assignment I have a patient whose arm is bleeding, and I'm going to try and control that to the best of my ability. So the first step is to put on gloves just for sanitary purposes. Over here you'll see my patient's bleeding arm. The first thing you're going to do is elevate that above their heart so that it kind of controls the bleeding a little bit better. The next thing that I'm going to do is clean the wound. So I'm going to clean that with a gauze pad, and at the same time I'm going to apply some direct pressure. And then after I apply direct pressure for a little bit, I'm going to go over and grab a bandage and secure that on there for him. If the bleeding does not stop for a little while, then I am also going to apply some indirect pressure. So after I'm done wrapping the bandage, I am going to apply indirect pressure. You can rest your arm until I need you to put it up. Okay, here we go. And then, okay, so if the bleeding doesn't stop, then I'm going to apply indirect pressure. So right here is where the artery can be found. I'm just going to do this until further help from 911 comes or the bleeding stops. And that's all. Thank you for watching. Hey Mr. Smiley, I know you can see me. This is Aubrey, right? So this video is going to be me applying a tourniquet to a victim with a wound on their forearm, on their right arm. So as you can see, the victim is applying direct pressure. I would be doing this, but I would have to use both my hands to apply the tourniquet. So the first step to applying a tourniquet is, please lift your arm, thank you. Tie it underneath and then loosely up here and tighten. And then from there, hold that and then put something firm in the middle of it so that you can tie the rest of the box knot. And then after that, you tighten that and then use that to twist. This is the most important part because it actually allows the tourniquet to get tightened much more properly than you could by yourself. Then after it's tightened, you tie the knot on the bottom, and then you're done your tourniquet. And this kind of just keeps the wound from bleeding too much and kind of blocks off the, that's all. Thanks, Mr. Smiley.